If you smoke cigarettes, did you know that there's a screening test that you should be asking your doctor about? That's right. And actually, the screening test is not new, but it's been updated, and you really need to know these updates. By the way, that's what we're talking about today. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician, an on-air health expert, and a video creator. By the way, if you like topics like this, health topics, COVID topics, I'm your girl. Make sure you subscribe to my channel and click the little bell for updates. Now, first of all, let me just say something to those who smoke cigarettes out there or smoke tobacco. I have a number of patients who do, and as a family doctor, and one of the things I always say is quitting smoking can be one of the hardest things someone has ever had to try to do. If you have tried to quit smoking and maybe it hasn't worked out, or you're not even sure that you're ready or whatever, if you feel some kind of way about it, let me be the first to tell you, number one, you're not alone. Number two, quitting smoking can be difficult. But number three, it's not impossible. And there are a lot of great modalities that we as doctors have to help you quit smoking. So first of all, my first commercial, and perhaps the most important, is that if you've ever thought about quitting smoking, don't be afraid to talk to your doctor, because we can help you through this. Okay? Just got to say that, guys, because it's super, super important. Now, let's get to this test that you guys need to know about. This is super important. This is a screening test for lung cancer. That's right. Now, we have screening tests for breast cancer. That's mammograms. Screening tests for cervical cancer. That's pap smears. Screening tests for colon cancer. That is colonoscopies. But when was the last time you thought about a screening test for lung cancer? Well, maybe you have, maybe you haven't. We have a screening test for lung cancer. It is called a low-dose CAT scan. It's a CAT scan of the lung that uses less radiation than other CAT scans. That is the test that we use to screen people for lung cancer. And smokers are the ones who really sort of apply for this, or rather apply to this. Now, the thing about it is the guidelines for these low-dose CAT scans of the lung have changed. And what has recently changed is that the criteria is now broadened. There are more people that can actually qualify to get this low-dose CAT scan of the lung to screen them for lung cancer if they smoke. And this makes me happy. So this is what I want you to know, guys. If this is you, and by the way, did you know that lung cancer is the leading cause of cancer deaths? Yeah, lung cancer is a big deal. We don't always talk about it, but honestly, we should talk about it more. Okay, so these are the people, let me go back to the low-dose CAT scan of the lung. The people that qualify for this screening test to screen for lung cancer are people between the ages of 50 and 80 years old. You have to have smoked the equivalent of 1 pack a day for 20 years or more. And you must still smoke or have quit within the last 15 years. Those are the criteria that would qualify you to be able to get this low-dose CAT scan of the lung. Now, you might be saying, okay, well, that sounds great, but what's the big deal? Why are you coming to us telling us this? Well, first of all, you should know about this. The second thing is the guidelines recently changed. The guidelines used to be a bit more strict, and the age range started older, you had to smoke more, etc. Now it's broadened. More people will qualify, so I want you to think about if you or anyone you know might qualify. Now, once again, 50 to 80 years old, you must have smoked the equivalent of 1 pack per day for 20 years. And by the way, the equivalent to that is also 2 packs a day for 10 years, or a half pack per day for 40 years. All of those equal 1 pack per day for 20 years, 20 pack year smoking history. And you still must smoke or have quit within 15 years. Guys, this is super important. You say, well, how do I get the screening test? I want to go get it. Well, I hope you're saying that in addition to thinking about whether you're ready to quit smoking, which I hope you are. How you get it, hold on. How you get this test is you go and you talk to your doctor and you say, hey, I heard about this screening test for lung cancer. Do I qualify? I do smoke cigarettes. I do smoke tobacco. That's all you say to your doctor. And guys, this is a screening test that you don't want to miss out on. Again, lung cancer is a leading cause of cancer deaths. If we can find lung cancers early, it can make, honestly, the world of difference. And once again, I want to encourage you guys who are smoking, or if you know someone who's smoking, a family member, don't be discouraged. And if you want to quit, hang in there. talk to your doctor, okay? And be hopeful. Guys, I hope this is helpful. Make sure you talk to your doctor. This is very exciting news. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, video creator. I do daily videos on COVID, health stuff, you name it, all sorts of stuff. If you like this type of content, please make sure you subscribe to my channel. Click the little bell for updates. Guys, I will be back soon.